Hello and welcome to Patient Power. I'm Andrew Shore. At the 2014 meeting of the American Society of Hematology in San Francisco, there was a lot of news, and some of it was about so-called NHL, or indolent follicular lymphoma. We sat down with a leading expert from Southampton, England, and that's Dr. Andrew Davies, to learn his views of the latest news, including excitement about a drug called Idelalisib.
Idelalisib is a new drug, and it's something called a PI3 kinase inhibitor. And this is one of the pathways that are very important in cellular turnover and cellular activity in the lymphomas, and seems to be significantly dysregulated in a degree of B-cell lymphomas. So Idelalisib is an agent that is able to switch off that pathway and hopefully bring about reduced proliferation, etc., of cells. And so we've been involved in a quite significant phase 2 study looking at this orally active drug in patients who have indolent lymphomas that have relapsed after having had rituximab therapy and also what we call alkylating agent chemotherapy, which is a whole class of different chemotherapies that we use for the treatment of indolent lymphomas. And they hadn't just relapsed, but actually they were defined to be refractory. That means that the lymphoma had grown despite having had these chemotherapies and the rituximab treatment, or very soon after having coming off the treatment. So it was a group of patients with very high-risk disease. Many of them had lots of different treatments in the past. And we did a study in indolent lymphoma of about 120 patients, and we gave daily Idelalisib to patients. And it was associated with a response rate in 57% of patients. So it's a really strikingly high number of responses in a group of patients who have shown themselves to be resistant to chemotherapy and to monoclonal antibody treatments. And what was important about that responses was actually that the patients who had a response often proved to be very durable. And the median, we've just presented some new data at ASH just now at the meeting, had a duration of response in the order of about 14 months. So a really useful agent for a group of patients where the disease is difficult. And actually the Idelalisib was generally very well tolerated. So there was some diarrhea that's been reported. There's been some abnormalities of liver function tests, but actually, most patients tolerate this drug very well. And if those abnormalities developed, generally things settle down very quickly by either withdrawing the drug or reducing the doses. So that was the drug as a kind of a single agent, as a single tablet to be taken. But actually now what we're doing is looking at Idelalisib in combination with chemotherapy further up or further earlier in the clinical course of the disease. So patients who are looking at chemotherapy at the first relapse or thereabouts. So we're looking at it in combination with rituximab and bendamustine. So it's a really kind of exciting new agent that works in a completely different way to conventional chemotherapies. If you've got something that's deliverable as a tablet, that's going to be automatically better off for patients in terms of the time that they have to spend in hospitals and hanging around chemotherapy day units. And it's good for us in the hospitals also because it helps our kind of capacity. I think, when we talk about tablets that aren't really, in quotes, chemotherapy, we do have to remember that they do still have side effects, and they're not just simple pills without problems. And so we have to be very careful about educating patients about some of the things to look out for and what they need to do and how we can support them if they develop any side effects. But absolutely, the whole idea of staying away from hospital and having a highly effective treatment out of hospital is really exciting.
There's a lot more news now and coming, and you can be sure that we are covering it. So take a look at all our interviews on NHL to keep you informed and, quite frankly, to give you hope for better care. I'm Andrew Shore. Remember, knowledge can be the best medicine of all.